Hi guys, I'm Dr. Brian Edwards, your local Coral Springs area chiropractor, and today I wanted to talk with you about wrist pain, more specifically carpal tunnel syndrome. If you've never heard of this, this is basically a condition where you have compression of the nerve that comes through this little tunnel here of the wrist. It's specifically the nerve that's compressed is called the median nerve, and it can cause numbness and tingling into the thumb, index finger, middle finger, and ring finger. And this is one of the most common causes of disability and lost work, and it affects millions of Americans each year. So what I want to do is show you some self-help concepts to help alleviate your symptoms and maybe even get rid of them. Basically, there's some simple stretches and exercises that you can do to help open up that tunnel and relieve some of that pressure on there, because ultimately you're going to help to prevent surgery. Typical medical treatment involves anti-inflammatory medication and some physical therapy, and if that doesn't work, then they're going in and they're cutting this little ligament here that comes around the tendon, so it helps to widen that area so the nerve can breathe a little bit. I've seen a lot of people who've had this surgery, and a lot of them, or a good portion of them, still have some carpal tunnel syndrome afterwards. So you have to ask yourself, what's the point of that surgery? Some people it works real well, but it's kind of hit or miss. So let's do some active, involved exercises that can help to alleviate your symptoms. And then what you have to do as someone who has this condition is think about the activities and things that you do that put you there in the first place. You have to look at your posture, your setup at your workstation. If you're working on a computer, you have to think about, are my wrists in proper alignment on the keyboard? Are my shoulders shrugged up like this, putting pressure, compressing the nerves that come out of my neck? You have to look at things that got you there in the first place. And you should look up terminology like ergonomics on YouTube, or just on Google ergonomics, and look at the ideal position of a person sitting on the computer with the elbows at 90 degrees. These are all things that you're going to want to pay closer attention to so that you can help to alleviate your symptoms. Now, the number one thing you need to do if you do have pain and swelling in the wrist that's causing you to lose your ability to do work or activities of daily living is alleviate those symptoms and alleviate the inflammation. And there's an acronym that we use called PRICE, which PRICE stands for protect. You want to protect the wrist. You want to consider getting a splint, a cock-up splint, to help stabilize and keep your wrists in ideal alignment. And these can be provided at this office or with your medical physician to help immobilize the area while you're going through a healing process. Rest the wrist. If you're doing something that's aggravating your wrist, you want to stop that. You want to modify what you're doing and how you do it. So you have to rest the area to get the inflammation down so you can actually do these exercises I'm going to show you. Ice. Ice is great because it helps to relieve inflammation and push fluid out of the wrist back towards your body, and basically alleviate the symptoms. Compression is the number 4, where you want to compress and work and mobilize this area. Compress and work the muscles, massage these muscles, get them loose. These muscles are tight. They're causing a lot of pressure to the nerves going to your fingers. And then elevate the area. Again, with the ice. If you're icing, hold your hand up so that we're pushing fluid back down into your body. So these are things you want to do. Once you get the pain and inflammation under control and you're actually physically able to move your wrist and attempt some of these exercises, then you want to proceed with the exercises I'm going to show you now. So again, the first and most important thing is think about what you're doing that's aggravating your wrist, and then get the inflammation under control, and then start these exercises. The first exercise you want to do is called the fist, bear claw, wide open hand. So basically you're going to make a fist and squeeze as tight as you can, to your tolerance, of course. If this is causing you pain, you might need a little more time with ice and resting, but to your tolerance, squeeze and then open the hands to form a bear claw like this. I don't want you bending here. I want you bending here like this, like Freddy Krueger's bear claw or bear scratching you. And then we open wide. So it's fist, bear claw, open wide. What we're doing is we're stretching out these tendons and muscles here in the hands, okay? And then the fist, we're working these muscles here. The second exercise is called the church steeple. So here's the church. We're going to open our hands like this, again, and pull our fingers apart as wide as possible while keeping the tips of our fingers together. And you'll feel a pulling and stretching in here. And if you have carpal tunnel, these areas are typically very tight. So you want to come in like this, open the wrist, come apart like this, and then come back. And the third one is called the shake and flick. You're just going to shake your wrist. A lot of people who have carpal tunnel, they do this already. They're writing and they're typing, and then they have to stop because there's so much pressure and pain here. So they got to shake and flick, and then they go back to what they're doing that's aggravating it. So shake and flick. Get some movement, blood flow in here. It helps to take pressure off the area. And the fourth one is forearm stretches. So you want to just bring your hand up like this. So you're stretching the flexor muscles of the wrist. So you flex these muscles back like this. Again, like this. And then we want to come down like this. And you hold these stretches for about 20, 30 seconds. To your tolerance, of course. Maybe you're not able to go back as far as I am, but maybe to here. Again, these exercises should be done to your tolerance. And you want to do these on a daily basis. You want to do these at least 3-4 times a day. Anytime you're doing any activities that cause your wrist to hurt or cause that numbness or tingling to reoccur, you want to start doing the fist, bear claw, open wide hand, shaking out the wrist, the church steeple, forearm stretches. You want to start doing these to help take some pressure off the nerves in the wrist. Again, do these on a daily basis and think about the activities and movements that you do that put you there in the first place, and try and figure out ways to avoid doing them. If you want to come into my office and discuss this with me, I'll gladly sit down with you and talk about what you can do to help alleviate these symptoms. I know, I realize you have a choice when considering the healthcare provider you're going to choose, and I put these videos out here to help better educate people about what they can do to avoid surgery. And you obviously want to try something that's conservative, which would in this case be chiropractic treatment with myself or any of the other qualified physicians who manage and treat carpal tunnel type symptoms. So if I can be of service to you, it would be my pleasure. And my phone number to the office is 954-915-7399. And you can check out my blog at drbrianedwardsblog.com. We have a lot of great exercises and articles on carpal tunnel specifically that can help you to alleviate your symptoms and maybe avoid even coming to the chiropractor. So with that being said, if I can be of service to you, give me a call. I'm Dr. Brian Edwards, your Coral Springs area chiropractor, saying have a great day.